Hello, my name is Marcel Marin and I will be presenting Unit 4 Lab of the mid-sagittal view of the vocal tract. The vocal tract is a series of resonating cavities above the larynx, which include the pharynx, the oral cavity, the buccal cavity, which is not seen, and the nasal cavity. The pharyngeal cavity extends from the area behind the nasal cavity to the larynx and esophagus, making up three main sections: the nasopharynx, the oropharynx, and the laryngopharynx. The oral cavity, according to Cycle, King, and Drumright, is the most significant cavity of the speech mechanism as it undergoes the most changes during speech. It extends from the oral opening to the facial pillars. The next cavity is the buccal cavity, which is not seen, but it is the space between your teeth and your cheeks. The buccal cavity is involved in oral resonance and high-pressure consonant production. The nasal cavities extend from the nares to the posterior apertures of the nasal cavity, which is called the nasal choana, which separates the nasal cavity from the nasopharynx. The left and right nasal cavities are divided by the nasal septum, and the oral cavity and nasal cavities are divided by the hard palate and soft palate. Next, we will speak about the speech articulators. We have mobile and immobile speech articulators. The mobile speech articulators are the tongue, which is the most mobile articulator, the mandible, the velum, lips, cheeks, pharynx, larynx, and the hyoid bone. The immobile speech articulators are the alveolar ridge, the hard palate, and our teeth. This concludes the mid-sagittal view of the vocal tract, Unit 4 Lab.